Chemo Tech is a public listed company on Nasdaq First North in Stockholm, and is a company that is devoted to science and clinical development, and have through this developed the next generation of electrochemotherapy. As ChemoTech technology today mainly focused on treating superficial tumors in late stage, our focus have been to go to the markets where such technology can be of best use, and that is in development countries. ChemoTech has, through the last 2 years, focused on India and Southeast Asia, and is now in the stage that we would like to go further on in our market. During our last 2 years where we have promoted our first device called IQwave, we have frequently received positive feedback from our doctors, key opinion leaders, and other people we meet in the marketplace. This have generated lots of interest from potential distributors from countries where we're not present today. So we have a long list of potential new markets and potential new partners that likes to promote our product. I started this company with a co-founder who is a retired surgeon, but Dr. Göran Hellers, who his name is not only a surgeon, he's also an entrepreneur when it comes to building up and teaching countries, especially developing countries, how to take care of cancer patients and cancer care. He has, through his company, established cancer centers in almost all parts of this world. And the relationships that he have gained through his career is, when we're building ChemoTech, of extreme importance. And I'm very, very pleased to have a partner like him. As IQwave now established the new generation of devices, it's important to point out the unique sales proposition of this product. In relation to the first generation, IQwave is not delivering a just fixed electric field, a power that is working together with chemotherapy, and the actual physical situation. What happens is that electrical field reduces the defense mechanisms in cancer cells for chemotherapy. So applying IQwave and the electrical pulses that it generates opens up the tumor cells and increasing the toxicity of chemotherapy. So a very, very low dose of chemo suddenly becomes very efficient when we treat these patients. But the first generation did not have the ability to adapt the power to different tumors. So some of them were sufficient treated and others were overtreated, which created, in some cases, a burn effect. IQwave has a built-in ability to just handle this problem, that we don't overtreat them or burn tumors, which is, in a sense, something that can be even worse than the cancer itself. IQwave also have a patent-pending technology that handles another problem that we've seen with the first generation of electrochemotherapy. And that is that the electrical field was not equally distributed through the tumor, which meant that the doctor had a risk to miss a number of cancer cells through the treatment, which in the worst case then created a regrowth of that tumor. IQwave can deliver the pulses from 3 layers or 3 directions, which creates a more even administration of these electrical pulses and minimizes the risk of having cancer cells surviving the treatment. Third part is IQwave has reduced the size of this device from some manufacturers having devices that is 1.5 meters tall and weighs 60 kilos. IQwave is now like a size of a larger laptop, weighing 5 kilograms, and with zero installation procedures needed. It takes 30 seconds to set it up. IQwave is built not only on a single device. For every single patient that is used where we use IQwave to treat, you also need patient and treatment oriented consumables. These are sterilized packages that can only be used once and should only be used once. So having a IQwave sold to a hospital doesn't mean that the income stream ends. For every single time that hospital is using our IQwaves, they also generate a revenue flow from these treatment kits. After the successful start of 2018, where we in the first quarter got orders for the first 3 IQwaves, we feel that we are quite confident in creating, for the first time now, sales targets for the next years to come. So 2018, our targets are to minimum sell 8 devices of IQwave, and in 2019 an additional 16 devices, which should bring us to a cash flow positive ongoing business. We really feel that we should increase the investment in the market approach to not only to the present markets, but also open up our business to new markets. About 40% as a listed company, we need to isolate to really create a good service to not only our shareholders, but we have many also regulatory things that a listed company needs to meet. And the last 10% we will focus on developing new applicators for our IQwave, but also to document and involve ourselves in further clinical trials. When first time I was involved with electrochemotherapy, and also my co-founders, Professor Persson in Lund and Dr. Johan Hellers, we all saw that this technology's power is not limited to different cancer cells. They are limited to the ability to reach them. So in 5 years, I hope that I have created, together with my R&D team, the ability to reach even cancer cells and cancer tumors seated further in organs inside the body. And if we can do that, I don't see any limitations of different indications where IQwave or any other developed products from Chemo Tech cannot be involved in palliative care of other cancer indications. First of all, a company that develops cancer treatments for tomorrow and for patients around the world, not only focusing on what we see here in Europe, North America, or other developed countries. I think many more and more people see this as a world problem, and therefore IQwave's approach of developing cancer treatment without discriminating the world is in time and is something that people like to invest in. IQ-Wave, what we have launched now, is a low-cost treatment that can be used in an OPD or environment, which means you can come in and leave the next day. It's also something that goes into the society today, where the cost of care is a critical part of many budget deficiencies even in Sweden, Germany, France, or US. Is not only linked to the ability to treat patients in Africa or in India. It's a problem we have here today. And ChemoTech is well suited for this challenge.